So there's lots of exciting new laser and light devices that are coming to market. So some of the ones that I'm most excited about would be, first of all, the OCT, the optical coherence tomography. Imaging is important in dermatology, and we have a whole slew of devices coming out that are helping us see the skin without doing biopsies and doing excisions. So the first one is OCT, and I think with OCT, I've been using it for the past 6 years. OCT, you can visualize the skin down to about 1.5 millimeters, and you can actually, it's like looking live down into the skin. So I've been doing work with scars where we can measure the scar depth and actually then tune our lasers to that depth. What was surprising when I was doing this research was that scars were much deeper than we thought, so I was probably under-treating them. In addition, an area that we published last year with Dr. Kristen Kelly and Dr. John Holmes is that we looked at port wine birthmarks and hemangiomas. And DOCMA has always said that those are very small vessels and we should use small pulse durations when we're lasering them. However, in the study that we published in Laser Surgery and Medicine, we found in port wine birthmarks that our blood vessel diameters were 80 and 90 micrometers in diameter, which means we probably need to use much longer pulse durations, 9.6 to 10 milliseconds in clinical practice, and we may get better efficacy. So we're seeing the skin through in vivo bedside procedure with no biopsies, no scars. The other exciting device that we've recently received in Miami at the Miami Cancer Institute, where I am chief of the cancer clinic, is the Vectra. And the Vectra is a huge 3D photography, whole human body, and within 3 milliseconds you can capture every lesion on a patient. You can do polarized light or non-polarized light and dermoscopy, and you can follow these lesions over time. In addition, the Vectra is telling us which lesions are the largest, which are the darkest, so it's going to help dermatologists be even more precise in those very difficult patients that have more than 200 dysplastic appearing nevi, significant genes or family history of malignant melanoma, and hopefully we'll be finding melanoma and other worrisome pre-skin cancers and skin cancers early. I call that the avatar. And lastly, we are entering the robotic era, artificial intelligence. I'm working with a company called Dominion, and they're doing a 1064 nanometer laser for lipolysis, for fat reduction and body contouring, and it has a robotic arm and it covers a huge area. The physician, the dermatologist, doesn't have to actually be operating it because it's above the top, but you do have to be in the room while it's being treated. It takes 15 minutes, and again, it's a robot. It's very, very exciting. So we're really seeing technology impact medicine in a positive way.